Morning everybody, it's Victoria from Elysium Aesthetics Health and Wellbeing. I wanted to talk to you and explain about an area of frequent questions that I have. This area here, from the nostrils, across the vermilion border, and down there, all of this area is called the upper white lip. So this is the periorbital area. When we are assessing this area, we're looking at lots of different things. So we're asking about the age of the patient, hormonal issues such as perimenopause, PCOS, postmenopause. And what happens as you get older is you lose elastin, collagen, and everything good that balances your tissue and makes them supple, hydrated, and to keep everything looking kind of flat and lifted. With this area, as you get older and go through the menopause, and we start to deplete estrogen stores, everything starts to break down. And because it's a muscle that does this, it creases like that. And people call them smoker's lines, they're just called periorbital lines for us. And there are lots of different fillers on the market and lots of different claims that are put in place to say that we can treat these areas. We can treat them. It's very difficult to get rid of the vertical lines that people develop completely. However, we have lots and lots of different techniques to help. We can inject Botox here, fairly superficially, which can make the lip look slightly thicker, which reduces this area. Because as you get older, this area lengthens, your lip gets thinner, and the bones resorb underneath, so all that structure underneath is also lost. And sometimes teeth problems can make this area less supported as well. So Botox can soften the muscular contraction, which is that one. You can see my lines, but I don't mind. So Botox can soften those by relaxing the muscle. Another technique we have is something called subcision, where we put a cannula in around here, and it just goes into a fairly superficial layer under the skin called subcutaneous layer, and we go back and forth very carefully, avoiding inflammation using a sterile technique, which induces a healing response, which then induces all of the goodness and things that you need to bounce up that subcutaneous layer, which supports the skin over the top. Another thing we can do is microneedling with radiofrequency, or microneedling with something like Wow Fusion, which uses tiny little needles over the area repeatedly, which also induces a healing response in the skin. Radiofrequency pops radiofrequency in via the needles as well, which again induces a healing response. There's different layers and different levels of inflammation that can be caused by that, so you have to know that your practitioner knows exactly what they're doing. And then another possibility is that you can have filler injected in this area. There are a number of fillers. There's Viscoderm, which is hydrophilic, very hydrophilic filler that's got a different technology in it than other fillers that we tend to use, because with this Viscoderm product, it actually stretches the skin rather than making it swell out or puff out. So you have lots of little tiny injections with a needle just into the deep layer of the skin, and it bruises, and there's nothing you can do about the bruising. You have to let that just settle, as bruises do, but that stretches the skin just of the area that you inject, so nothing actually sticks out or pops out. You have other fillers that are cross-linked or non-cross-linked. You have Redensity 1, RHA1, and you also have some Belotero Soft that you can inject in this area. And if the lines are incredibly deep or very, very hard or leathery, then you can have other procedures such as resurfacing with laser, or plasma, or Neogen plasma. So there's lots and lots of different options that you have for this whole treatment area. But again, as with everything that we do here, you must have a pre-treatment consultation to assess your skin, medical background, aesthetic treatments, and all of the history that leads you to the place that you're at now, in order to know the best possible procedures within your budget that will give you the results that you're looking for.